Aside from the occasional mild headache, maybe a little sinus issue during allergy season, and perhaps after an evening of bad decisions, I don't get headaches very often. But I know people who do, and there are people out there who suffer regularly and pretty much chronically from headaches, migraines, and things that actually prevent them from really being able to have a happy and fulfilling day. And a lot of times, you're treating the symptoms through medication rather than finding a cure for it. Well, there is the Valencia Headache Care, or Valencia Headache Center here in Santa Clarita, that offers insanely wonderful alternatives to just treating the symptoms. Here with me this morning, Dr. Dean Schweitzer from Valencia Headache Center. And good morning.
Good morning. Thanks for having me. Appreciate it.
You bet. And again, we're not talking about the occasional little thing where maybe an aspirin will just go ahead and take care of things, or just maybe a day of drinking water after I said a night of bad decisions. We're talking about chronic pain, right?
Absolutely. 45 million people in this country suffer from some level of chronic pain, migraine pain, jaw clicking. It's very prevalent. And it's very debilitating. Even a otherwise normal healthy person can be very debilitated by headache pain, and causes depression, anxiety, definitely detracts from the quality of their life.
Do you find, doctor, that people are surprised to find out that the source of their headaches come from usually jaw or tooth issues?
Yes, because when you have a headache, you feel like it's in your head, in your forehead, in your skull, or in your jaw. And it doesn't seem like the source of that pain is going to be coming from an imbalance in your bite, which is really where the source of the pain is coming from, even though you can't feel that imbalance yourself.
So let's talk about the imbalance in the bite. When we talk about treatment for that, are we talking about something major? Are we talking about medication? What are we doing? What are we talking about balancing?
This is not dental work. This is not invasive treatment. This is very minor, very imperceptible adjustments that are being made to your bite over a period of time, but guided by some very amazing technology that we use that allows us to determine every single bite force that you have and what the distribution of those forces are. And we use that digital blueprint as a guide to making these adjustments.
So it's a kind of a slow process, not necessarily, like you said, nothing majorly invasive, or not attaching a metal jaw to where your bones used to be or anything. I mean, people do have those kind of visions of radical surgery or having things locked up so they can't talk for weeks on end. We're talking about just something almost, the closest I can imagine is something like orthodontia, where it's just kind of over time, right?
Yeah, it's over about a 12-week period of time that we do this, and we do it in combination with rehabilitation of the muscles, because the facial muscles are stressed and strained and constricted by the imbalance. If you think about it, every muscle pain that we have is usually because something's out of whack, something's out of balance. And it's the same thing in your face. When you have a bite imbalance, it causes your facial muscles to be imbalanced, which then manifests as pain. Most people don't realize this because very few dentists have any knowledge, expertise, or training, or the technology to actually even understand this.
So is it pretty much all you have to do is balance the bite and the headaches go away, or is there more to it?
No, there's more to that. Balancing the bite is the first step in creating a pain-free environment for our patients. But we have to rehabilitate their muscles as well, because they've been so out of whack for so long that we have to rehabilitate them through different kinds of modalities that are very common in sports medicine, actually.
We're talking with Dr. Dean Schweitzer of the Valencia Headache Center, talking about the imbalance in your jaw or your bite that actually causes the majority of headaches that are out there, and especially the chronic pain that you feel. So I want to talk about this, though. When we talk about rehabilitating the facial and neck muscles, what does that involve?
It's very easy. It's very comfortable for our patients. It's somewhat like going to a spa treatment for a day. We use ultrasonic therapy, deep tissue therapy, microcurrent therapy, and cold laser therapy. And it happens over the course of about an hour and a half once a week for about 12 weeks. And during those sessions, we're also taking a look at the bite using our digital technology and making very small and perceptible adjustments that take 2 to 3 seconds apiece. And over that period of time, we begin to balance the bite, rehabilitate the muscles, everything gets healthy, and our patients become headache-free.
So who is your best patient? Is it the person that suffers like the occasional headache, or is this like migraine sufferers, chronic pain sufferers? Who are the ones?
Most of our patients are patients that have anywhere from 10 to 25 headache days a month.
Wow.
Yeah, it's really unfortunate. People come into our office in tears because they've been so many different places and nobody's ever been to help them before. And they're almost desperate. And what we do is it's almost miraculous. It's amazing.
And, like I said, I've been pretty lucky on that regard, but I know I have friends of mine who suffer from migraines, and that's it. They can't do anything but sit in a dark room and just wallow in pain. There's nothing else that they feel they can do unless they're like chugging down the big giant Motrins or whatever else has been given to them by their medical doctor. Is this the type of person who should probably maybe at least swing by and get a consultation?
Absolutely. This is the type of person that we can help, that we do help, that has been helped across the country with our protocol. And it's something that most people don't realize is out there and available.
So Valencia Headache Center, what's the best way to get in touch with you?
Best way to reach us is either come visit our website where you can learn a lot of information about headaches and what we do, and also get contact information. But our phone number is area code 661-287-9667. And my staff's amazing, and they'll be happy to talk to you. And you can either make an appointment for a complimentary consultation to understand what we do and see how we can help you, or you can come in and get a full diagnosis and get underway in treatment.
And a complimentary consultation, right? You're exactly right. And the
Yes.
website is Valencia.
ValenciaHeadacheCare.com.
Very easy and great website too. I was taking a look at it before you showed up. Lots of great and comprehensive information. You are right.